back to hard politics with a question from Kate Hennessy, please. Kate Hennessy.
David Cameron claimed the NHS was safe in his hands. Given the cuts and closures around the country, is this still the case?
David Cameron claims the NHS was safe in his hands given cuts and closures across the country. The cheers, needless to say, because Lewisham is directly affected. We may hear about that, but let's go to the main point. Is it still the case the NHS is safe in the hands of David Cameron? Ed Davey.
Well, it's the coalition government that is going to decide health spending. The coalition government has increased health spending. It's not cut it. But there are some real issues in different parts of the country. Here in Lewisham, you're experiencing what I had in my constituency before the last election, a threat to your A&E and, in my case, into a maternity unit as well. And I'm extremely alarmed about that. I campaigned really hard to stop that, which we succeeded in. Here, you've got a real problem. There is this report that's gone to the Secretary of State for Health, Jeremy Hunt. No decision has been made. He says he's going to make it, I think, in 20 days' time. It's really difficult. And what's really weird in this decision is Lewisham Hospital isn't part of the trust that's got the debt. So the administrator's report, which is recommending changing Lewisham, he was brought in to look at what's happening in the trusts nearby. They have real problems. They have real problems because of a PFI deal, as in many other parts of the country, signed under the last government, which has gone completely out of control. By next year, I think next financial year, there'll be £200 million of debt in the healthcare trust next to Lewisham, but I don't see why that should impact on Lewisham. I can't prejudge the decision that the Secretary of State for Health is going to make. He's got to look at the report and make his decision. I'm pleased in the House this week, he said he's going to meet local MPs from Lewisham and nearby, so they can put their voice to him, they can represent their people, and we'll have to await his decision.
OK, I'm sure, yeah, all right, I'm sure we'll come back to the Lewisham point, which is the A&E here being closed down because of a merger, because the neighbouring lot went bust and were taken over. But I want to draw you to the UK Statistics Authority. The question was, is the NHS safe in Cameron's hands? The UK Statistics Authority says that in 2011-12, expenditure on the NHS in real money is less than it was the year before, i.e. expenditure on the NHS is actually going down. True or false?
Well, when we set the spending review over this Parliament, we were saying that NHS expenditure would be kept at the right levels. Under the Labour proposals, they were going up. Under the Labour proposals, they were going to cut NHS spending.
But it's going down.
Indeed, well, hold on. The spokesman for Labour at the moment has said that they would cut health spending. The coalition government is not cutting health spending.
Let's talk about your government. He said that back in 2010, but the statistics now show that spending is lower.
Well, I haven't seen that statistic report. What I have seen is the spending plans that we set out in 2010, and they show that over this Parliament, spending on the health will continue to go up.
John Prescott.
Well, does it mean that what the statistics people are saying, in real terms, you're spending less? And there's an argument about it. There may be for good reasons. You might say it's to do with the debt and blame everybody else for that. But that is happening. And he said it wouldn't happen. As with Lewis, it's another promise he's got.
Why are you proposing to cut it?
Well, you're talking about somebody... I don't know the actual quote you've got. He's asking you, what does the statistical body say about... Is it reducing? No, you haven't answered it. Do you deny what the statistics say? They say it is, in fact, reduced.
I've been saying that the spending plans we've set out...
I don't know what you're saying. What about these guys?
Well, I haven't read his report. I can show you the report that we've set out.
Do you deny the authority of that?
I will tell you, I've seen some of the health reforms that are really difficult that we put forward, but we're putting power in the hands of local GPs and local clinicians so they can make decisions. Under Labour, all the decisions were made centrally. They didn't take account of what was happening in local communities. They didn't take account of what was happening in local opinion. That was the problem we had in my constituency when we were faced with a closure of our A&E maternity. So I have to say, John, our reforms, yes, they're difficult, but we are trying to make sure that local people have a voice, and I hope they have a voice here in Lewisham.
You tell them in Lewisham.
The woman here in the front row.
That really is not true. The views of people in Lewisham, the views of all the clinicians in Lewisham, the views of all the GPs in Lewisham have been deliberately ignored by Kershaw. And
Who's the man in charge of the reorganisation of the trust?
He's the trust administrator. And the plan for Lewisham Hospital was hidden away in an annex to an appendix in the draft report. It wasn't in the consultation document. And then when I looked at the plan, every single entrance to the hospital was going to be sold off, and our brand new A&E, maternity care and urgent care centre were all going to be part of the land that would be sold off.
But,
I think that's right.
There's obviously a problem here because you have a particular issue here in Lewisham, as other parts of the country do. The question was a more general question, and Nadine Dorries, perhaps you'd like to answer that, which Tories claimed the NHS was safe in their hands. The statistics show spending is not keeping up with the real cost of the NHS. You still argue it's safe in Tory hands?
Yeah, I do, and there is a commitment to increase real-time spending on the NHS, but this is a particular situation that you
rather fast.
Well, there is a commitment to continue increase spending in the NHS. There is a commitment to that.
But spending in real terms. I mean,
spending in real terms.
But then, so why is the statistical authority saying that's not happened?
Well, I've never even heard of the statistical authority, so
Andrew
I've never even seen
Andrew Dilnot, who ran the Institute for Fiscal Studies, who's a well-respected figure.
Yes, I know Dilnot.
You know Dilnot. Well, it's he who said it.
Well, I don't take my information from Dilnot, but
you take it from Cameron, then?
Well,
he's wrong.
Well, what I do know is, and I've looked obviously into today, and I've been out and spoken to the protesters tonight when I arrived about what's happening in this particular situation. I do know that the South London Trust has 2 hospitals in it, which in 1998 were set up on a PFI agreement, which meant each hospital pays £135 million, another £36 million per year each in interest payments. How John, Gordon Brown and Ed Balls ever thought a hospital trust could exist with that, I have no idea, with that term at that level of debt. Okay. And unfortunately, Lewisham Hospital, which actually was set up on a much better system and performs very well and is a good hospital, has been looked at by Kershaw in the overall South London picture to come in, and really Lewisham is coming in to save the bad financial arrangements that were set up for the other 2 hospitals.
How can that be fair?
Well, it's not fair. It is not fair. You know, I trained as a nurse actually in Warrington Hospital, in a hospital which is very much like Lewisham. I have one in my constituency, Bedford Hospital, where people are born, they have their own babies, they die, they have all the major illnesses. It is a hospital that people care passionately about because it's such an integral part of the community. And actually, the reason why that hospital is under threat now is because what Gordon Brown and Ed Balls set up for the other 2 hospitals in the past, and that is shame on the previous Labour government. I hope it's saved. I hope it is saved. Jeremy Hunt has made no decision yet. The decision will happen in the future. He will look at it soon, and I think it's in 20 days he has to make a decision. He is going to look at, but I do know this, that I know there's a complaint that people haven't been listened to. I spoke to the protesters and they told me that tonight. They said exactly what you've just said, that clinicians, local people and patients, nursing staff were not listened to in any way whatsoever. I, tomorrow, will speak to Jeremy Hunt and take those messages back to Jeremy, because if my party is about anything, it professes to be about localism. And if it seriously is about localism, then it will take those people's opinions into account.
OK, thank you. Will you go and talk to Jeremy Hunt tomorrow morning, like Nadine? Go with her, perhaps?
Actually, tomorrow morning in my advice surgery in my constituency.
So am I, actually. I will text
but
him.
next week, I know that, for example, I was talking to Simon Hughes, who's put in a submission to the administrator, and I know that Liberal Democrats locally are campaigning on it, and I know that the local MPs, because Jeremy Hunt said they could, will go and meet him, and that's as it should be.
Let's go back to Kate Hennis's question, which was Cameron said the NHS was safe in his hands. Clearly, a lot of people here, because of this issue, don't feel that, but let's go back to that point. You, sir, over there on the left.
The coalition government broke its pledge not to introduce any top-down change by introducing the biggest top-down, the social health and social care bill. It's the biggest ever change introduced in the NHS by this coalition government.
Do you feel that because you work in the NHS or are a patient of the NHS?
I work in the NHS.
You work in it?
Yes.
As what?
As a doctor.
Right.
And the coalition government is pushing on more than £20 billion worth of saving over the next 3 years. And the NHS total funding is about 85 billion. That gives you an idea of some perspective about it. A safe hospital locally is about to close. Now make a judgment, is NHS safe with this coalition government?
I was very disappointed, as you were, that the health bill last year focused so exclusively on structures and on moving the chess pieces around for something at GP commissioning, as you say, which is quite expensive, is sucking up a lot of money and a lot of energy at a time when the service needs to actually save money. And I was also disappointed that because it was so focused on structures, it wasn't focused on what I think are some of the most vital issues for patients, which is nursing care. You know, the failures we've seen in mid-staffs, the failures we've seen in a lot of hospitals, people having to drink water from vases. I mean, those are extreme examples, but actually there's too many of those examples. And that issue seems to me to be one of management. So there are some fundamental management failures in the NHS. And if you come back to Lewisham, that's what's happened in the South London Healthcare Trust. I mean, they've been landed with this PFI contract. They haven't been able to manage that, and they're all over the place. And I had a couple of calls from doctors from Lewisham this morning because they knew I was coming on the programme, and I had quite a long conversation with one of them. And it's very clear to me that it's not sustainable, that, you know, they're spending 70 million a year. When you're spending 70 million a year propping up one hospital, you're taking that from another hospital to prop it up. So it's not free money, and that's got to stop, and you've got to put better management in. But when I looked at this, I thought, sometimes you do have to close things. We can't all live in a world where we pretend that every single thing has to be kept open, and probably there are some A&Es which may have to close. But this area, it seems very surprising to me that after a very rushed consultation, they're saying they want to close Lewisham A&E and move people, 5 miles maybe, down to Woolwich. Quite a long way for people to travel. Very worried about will there be enough space when they get there. And they're actually, in a way, all that's doing is it's rewarding the bad management. You know, Lewisham Hospital... Lewisham Hospital is a solvent hospital. It gives perfectly good care. A lot of people care about it. There is apparently a proposal, which I think Jeremy Hunt should look at, which is Lewisham Trust has said it's happy to go in and take over Woolwich and try and apply better management to it. Well, I think that's a way out of this problem, and I think Jeremy Hunt should give that a try before he starts closing things down.
And John Bird.
Well, I was speaking to some of the people outside, and they... one of them suggested to me, and I hope it's not true, that there's a bit of gerrymandering going on here, that what you've got is Lewisham, because it's largely probably a leftish or working-class area, is hit, while the other areas, which are more likely to vote Conservative, are going to be left with their hospitals.
That's not
so
true.
That may be a scurrilous piece of information which I've now passed on to you. I think, as a person who's used the hospital system on and off for many years, I've had many broken toes and many broken noses, I can tell you that probably since the middle of the 80s, the National Health Service has been in a permanent state of rebuilding, renaming, re-this, re-that. And I think we must try and find a way of stopping this permanent state of repainting, redoing, re-aiming, reallocating. And I think that's one of the real problems that we're facing. I also want to ask the leading question, which I think all of us who are concerned about health, is why is it that the National Health Service, which was started as a National Health Service, which was more about self-health so that people would make themselves healthy, why is it that only 1% of the budget of the National Health Service is spent on prevention? And we know that prevention is much better than cure.
OK. I see from the clock that we've only got a few minutes left. I'm sorry, we can't... You're looking very keen to come in. You could just... Very quick, if you promise to be very quick.
Thank you. I don't think the NHS is safe at all in David Cameron's hands because he has actually quite blatantly lied. Nadine, if you're going to see Jeremy Hunt tomorrow, would you take some of us with you? Because we're trying to get a meeting with him and he doesn't want to talk to us because he thinks he's already done this consultation.
All right,
and it was a complete sham.
You can meet her after the programme.
Thank you.
Murdoch had no problem.
Okay. Right. Let's...